Hello wonderful students, myself Dr. Maddineni Srinivas, welcome to Crack Derma DrMSD. So in this video we are going to look at one very important topic, Lichen Planus, which was asked in the theory question. As you can see here, definition, clinical features, treatment modalities and complications. So we are going to see all these features one by one, and after watching this video do read from any of these books, and also I would suggest you to share this video with your friends and also try to discuss the important points which I am going to highlight in this particular video, so that you are going to remember in the examination what are the most important points which you have to definitely mention, and if possible also try to underline or highlight whatever you want to do. Yes, what is the definition of the lichen planus? So remember students, lichen planus is very itchy condition. So itching, we call it as pruritic condition. So lichen planus is a pruritic and inflammatory dermatosis. So there will be certain inflammatory cells which are associated, which are lymphocytes. So it is an inflammatory dermatosis, and it will not only involve the skin, but it also, lichen planus also is going to involve the mucosa, and also the nails will be affected and scalp can also be affected. So hair involvement, nail involvement, mucosal involvement will be there apart from the skin involvement. Very important to remember. And it is an autoimmune condition often associated with mucosal involvement and rarely also causes scarring, alopecia or nail dystrophy. So these are the changes which will be seen over the scalp and in the nail. So in the nail there is going to be a dystrophic changes, that is damage of the nail can be seen. And alopecia is, what is alopecia? Alopecia is the hair loss. So we'll see one by one all these important features. So coming to the involvement of the skin, first you should remember, whenever MCQ is asked, okay, you can simply remember what are the important features of that disease. But when you are asked a theory question, so you have to write down according to the question which is asked. So in the clinical features, you must remember the age and sex predilection are very important. So simply you can remember lichen planus is very commonly seen in middle-aged women. This is a condition where lichen planus is commonly seen. And in the characteristic lesions, in the clinical features, remember 5 P's. Okay, in fact there are so many other P's also. Lichen planus, so in the name itself there is one P. The lesions are planar. What do you mean by planar? Planar means flat, and the condition is very itchy. So we have seen this already. Pruritic lesions will be seen. Pruritic is itchy lesions, and the lesions are going to have a purple color. Okay, purple color will be there, and the shape is polygonal shape, and the type of the lesions are papules and plaques. So itchy condition with which is going to have a flat topped lesions. Lesions can be papules or plaques, and this shape is going to be polygonal, and the important symptom is very important, itching, pruritus. And this purple can also be sometimes mentioned as violaceous. Why am I telling you this? Is because there is a possibility this could be asked as a 15 marks long answer question also, where they will give you various clinical features of the skin lesions and they may ask you a question. So you should be prepared for that also. And where are the lesions seen commonly in the lichen planus? It is flexor surfaces. So instead of flexor, if you can remember it as flexor, so there is one more P. So what are all the P's? Very important to remember. Pruritic, purple colored, polygonal, flat, that is planar papules and plaques. And where are they seen? They are going to be seen mainly over the flexor aspect, as you are able to see over the wrist. Okay, so any flexor aspect, these lesions can be seen. Next is the additional features which you have to remember. Additional features which you have to remember is the WICKHAMS STRIAE. Very important buzzword which you have to remember related to lichen planus. What is a WICKHAMS STRIAE? Basically, there is going to be lace-like pattern of whitish skin which will be seen in the lichen planus patients. This is called as WICKHAMS STRIAE. WICKHAMS STRIAE can also be seen over the mucosa, as you are able to see here. So whitish lace-like is network-like pattern can be seen over the skin as well as in the mucosa. This is called as WICKHAMS STRIAE. Very important buzzword, which you have to write in the examination. And next is Koebners phenomenon can be seen positive in the patients of lichen planus. What is Koebners phenomenon? Basically, it is development of the new lesions at the site of the trauma. So, we have already seen in the definition that lichen planus is an autoimmune condition. So, in the skin, when lesions are present at one site, the patient is going to have the autoimmunity in the other areas of the body also. So, then what happens if there is a mild trauma of the skin in the place where there are no lesions? Because of the underlying autoimmunity, there is a possibility that the lesions, morphologically similar looking lesions, are going to develop along the lines of the trauma in the patients of the lichen planus, and this is called as Koebner's isomorphic phenomenon. What is it called as? Koebner's isomorphic phenomenon. Why is it called so? Because at the site of the trauma, okay, at the site of the trauma, similar looking lesions, okay, iso is similar, morphic is appearance. Similar appearing lesions are developing along the lines of the trauma. So, this is called as isomorphic response, and you can see the patient here having lichen planus lesions, and you can see that in a linear fashion the lichen planus lesion is developed at the site which is far off from the actual lichen planus lesion site, because the trauma has induced the autoimmunity to produce a new lesions. Okay. And also remember students, in this lichen planus there is going to be one very big problem, that the lesions are going to heal with a very bad pigmentation, which is called as post-inflammatory hyperpigmentation. So after the inflammation resolves, there is going to be a very bad pigmentation. I will show you the picture at the end. Okay. So this is another P which you can remember, that is pigmentation. So we have seen pruritic polygonal plain top papules and plaques, and along with that we have also seen there is going to be pigmentation. Another P, the site is plexus. So there are not just 5 P's, there are so many P's which you can remember in the lichen planus. Next is mucosal involvement. Remember students, mucosa is also going to be involved in approximately 30 to 70% of the cases. There can be mucosal involvement, and yeah, there can be painful erosion. So you can see here there are this whitish lacy pattern you are able to see in the buccal mucosa. It is WICKHAMS STRIAE, and also there can be possible erosions developing in these patients. And what is the importance of this? In the complications you will understand that these erosions, they can turn out to become squamous cell carcinoma. So very important to monitor these patients very closely. What is the nail involvement? See, nails can be affected in a less number of individuals, so 10% of the cases, and it can lead to thinning of the nail. And remember students, thinning of the nail is the most common nail finding which you can see. And one very important named finding which you are going to see in the lichen planus of the nails is pterygium formation. So I hope you have read pterygium in your ophthalmology. What is a pterygium? Wing shaped structure. So here what happens in the lichen planus, the proximal nail fold, this portion is called as a proximal nail fold. This is going to encroach the nail plate. Nail plate is the part of the nail which you can touch and feel. Okay, the nail plate will be damaged by this proximal nail fold, and the proximal nail fold will attach itself onto the nail bed. Okay, giving the appearance of this nail just like a wing. So that is the reason why it is called as pterygium formation. Very important point which you have to remember. And in the scalp involvement, remember there is going to be lichen planopilaris, which is lichen planus of the hair follicles. So pilaris is the hair follicles, and remember very important, whenever the scalp is affected by lichen planus, there is going to be alopecia, hair loss will be there, and this hair loss is going to be scarring alopecia. That is permanent hair loss will occur in these individuals. Permanent hair loss will occur, and you are able to see this pilaris, the hair follicles are appearing erythematous and inflamed because of this is an inflammatory condition. Okay. So I hope this video was helpful. If it was helpful, we are still having treatment modalities, but before that, do remember to hit that like button so that it will boost my morale, and also do share this among your friends, and try to, if not possible to share, at least try to discuss this topic so that you are going to score very good in the medicine paper. This is skin which is going to carry almost 10 marks in the medicine paper 2 part B. Okay, coming to the treatment modalities. Topical therapy, we have systemic therapy and also phototherapy is available. In the topical therapy, remember, very important, most of the patients are going to respond very well to potent corticosteroids, that is topical clobetasol. You need not remember the percentages, just remember clobetasol twice daily application is very helpful for lichen planus in the topical treatment, and tacrolimus and pimecrolimus are other treatment modalities which are used if the lichen planus is resistant to the other treatment modalities. Next, we have in the systemic therapy, again the steroids are going to be used, but short course of oral steroids. The preferred agent is prednisolone, and in the refractory cases there are other agents which are used. You need not remember all these names, okay, just remember immunosuppressants can be utilized, immunosuppressants and HCQs. I hope you all know this anti-malarial agent HCQs. These also have a role in the lichen planus. And in the phototherapy, that is the light therapy, we have done a video on the phototherapy also, so I will leave the link in the comment section, also description in the iCard for you to watch. So UVB, ultraviolet B, PUVA therapy can also be used, and UVA1. If the patient is having widespread lesions of lichen planus, we can make use of this phototherapy. What are the complications? So one of the complications we have already seen, that is squamous cell carcinoma in the oral ulcerative lesions, and cicatricial alopecia also we have seen. So what is this term cicatricial alopecia? So just remember students, whenever we have scarring alopecia, okay, we can make use of this term called as cicatrix. Cicatricial simply means scarring type of alopecia, that is permanent hair loss. And we have already seen this post-inflammatory hyperpigmentation. So you can see here, this is the bad pigmentation which will be left behind once the lichen planus lesion heals. So I hope this video was helpful, and if it was helpful, please do hit that like button, and also do comment if you are having any doubts. And if you want any more topics to be discussed, please put the topic in the comment section, and also share this among your most best friends so that they are going to score well, and try to discuss whatever is discussed in this particular video, and try to read after you have seen this video from the books which I have mentioned, okay. And this is the next topic of the video, and if you know already what is this topic, try to put the diagnosis in the comment section. And thank you so much for watching this video till this point. I hope it was helpful, and also you can join my Telegram, Instagram group. And thank you so much. Happy learning, all the very best. Sarve Jana Sukhino Bhavantu. Sarvam Sri Krishna. Bye bye.